we have Dorota with us today from Zero Waste Europe. And she will talk about hazardous chemicals in plastic. And I will let Dorota do everything else. Thank you.
Good morning, everyone. Okay, so I just have to change here. It's not too much technology. Good morning, everyone. Well, so just really super brief about my organization. It's not the one probably you are really very much familiar with. So Zero Waste Europe is actually like a European network of communities, experts, organizations, and we all work towards eliminating waste in our society. So basically, we really address the upstream, the prevention methods, and how we do it, mostly through referring to sustainable strategies and applying of circular economy practices. And we work both on, with different NGOs, we support local groups, communities. We also actually are very much involved with mentoring the cities and authorities. Brussels is also one of the zero waste cities since 2 years, I believe. And we also are very much involved with discussion on the European level about different pieces of regulations that would, in general, should enable us to have more zero waste future. And today I will just really briefly start my talk with a brief introduction to hazardous chemicals and the plastic pollution. We'll dive a little bit more into the details around impact of harmful chemicals and plastic on the human health and circular economy, and I will wrap up with some thoughts about solutions and alternatives. Well, actually, each of those bullet points could be a subject of 20 minutes presentation. So I will just do really very quick, like overview presentation, but I put more information on the slides. I'm not going to read everything, but hopefully you can use it afterwards as handy training materials. I'm sorry, I need something to drink. Okay, but in the meantime, maybe we'll start. So you can study this, this very interesting slide already. I was talking too much yesterday, unfortunately. So apologies, but let's start with the big picture, and Europe is definitely a part of this big picture. So we have, the whole world actually is facing the triple crisis. Apart from climate, we all heard, we have really serious problem with the damaged nature, biodiversity, and there is a pollution crisis all over the places. Last year, the scientists concluded that the planetary boundary for chemicals and plastic has been crossed. So we basically are simply producing, using, and disposing too much. And we know that the chemicals, even if there are already around 350,000 of different chemicals already recognized, there are still new are produced, and we are basically using them more and more. And then if you look actually, so those hazardous chemicals, you see the health hazards and the environmental hazards that are now required in the European legislation. So for those hazards, the manufacturers should provide the data for any chemicals they are putting on the market. And while the production is in 2021, we have more than 200 million of tons of the chemicals that are classified as hazardous to the chemicals, hazardous to the health, and 85 million tons of chemicals that are classified as hazardous to environment. And actually, the big problem is that we don't know the hazards. We don't have enough information for big majority of the chemicals. So if you see from those 100,000 chemicals that are on the market in the Europe, only 100 of them are really extensively characterized. There's 10,000 fairly, 20,000, let's say, with limited characterization. That can mean basically that you know one of two hazards that are really well known, and majority have very poor characterization. So we actually, well, we use a lot of chemicals that we don't really know what they have an effects of our health and environment. And I wanted to put this slide because a lot of us are thinking that we are in Europe, like we have the best regulation. It's kind of true that the chemical regulations are in Europe the most ambitious, but unfortunately, generally the chemicals are very badly regulated in the world. So we can comparison, we are better, but there are still many issues. And one of this is the fact that while it takes really literally a couple of weeks for the company to get the access and to put the chemical on the market, and the information is actually very much limited. We know that around 30% of all the REACH dossiers are actually not compliant with the required information. Then once these chemicals are studied, it takes years, even decades actually, to restrict those chemicals we find that they cause harm. So basically the main burden actually still went on the public agencies and the scientists and not on the manufacturers. And then if you look at the plastic, of course, I think we all see the plastic everywhere in our environment. That is something that is, well, it's difficult to miss. We all see this terrible, actually, news that's mostly outside the Europe, yes, where we actually also were happily sending our waste for years. So this plastic is everywhere. And the problem is actually that we produce it so much, we only a little bit of those plastic is recycled, and only very little is recycled more than once. And the OECD make the estimates that if we keep on doing like we do now, by 2060 we even triple the amount of plastics. And then majority of this waste still will be short-lived items such as packaging, low-cost products and textiles. This is already a problem. And the problem became such big that worldwide we achieved the consensus that this is the need to have like a global treaty to really start to solving this the plastic problem. And if you look at the environment, I have one slide about the environment because, well, first, as I said, volume. The volume is basically cause a lot of littering. So we see the animals like suffocating basically in plastic, and that's one problem, visible problem. But there is also those microplastic. I think that Andrea already mentioned it. So during the whole process of use and disposal of plastic, there is those very small tiny pieces of microplastic shredding, and we already know that they are in air, water, land, in soil. We find them in all the organisms, and then we have when this plastic is not littered, then we have also the big problem with burning it. So this was upper burning that's happening a lot in the global south. But actually, we also see in Europe more and more like this fires in the landfills. They really became kind of like epidemic all over the Europe, and that's probably also to high degree is related to the fact that there is a lot of illegal stuff going on, and this plastic is simply not able to be processed. And then we have the incineration, so it's controlled, let's say, or burning, but still it's not really like a clean technology. It still produces a lot of toxic ashes, and during the burning, there are still emissions of dioxins, PFAS to the air. So yeah, that's whatever we do with plastic is actually always the problem. Then in EU, we already have, since a couple of years, we have a certain initiatives taken by the European Commission that tries to solve a bit, to help us to solve the plastic problem. And mainly what they focus so far, so to eliminate certain single-use products, to really push more to the recycling as this waste management way to manage waste, so also to produce less and use more recycled plastic in the future. And then we have also like circular economy plan and the chemical strategy for sustainability. That's really, we are saying that if we are going really to move to circular economy, we have to pay attention to those non-toxic material cycles, and we have to address properly all the harmful chemicals that are present in the plastic. If you look at this, so it's around chemicals of concern, it's around 13,000 identified as different, so there are the monomers, these building blocks, and different kind of additives and processing aids. They have a special role to do it. They can be flame retardants. They can make the plastic more hard, or make more soft. There is a number of the most used, you see on the left side, those polymers that are the most used. So they are produced in the highest volumes and applied in different products. Some of them are less problematic, some more. So like polyvinyl chloride, actually, it's a special one because it uses the highest number of different additives, also the highest volume. But I believe that will be, PVC will be addressed in the next presentation. But there is also the fact that if you mix all those different polymers and additives, we are getting really kind of fantastic, really functions of different plastics. And this is why actually plastic is now all over our life in all different sectors. Majority is still used in the packaging, quite some in transport, electrical equipment. Those numbers are actually reflecting the use in Europe, building materials, because we have also in flooring, in piping, in the window frames, and of course also medical devices and textiles. We are actually also rising. So what is the impact of those chemicals? And well, the problem is that those additives used and the chemicals in the plastic are many of them tend actually to be released during the life time of any product, and they basically we are directly exposed to them. And in last 4 years, there is a number of really big reports, very good reports and briefings targeting specifically the issue of how plastic is impacting human health. So there's a lot of information put all together. So yeah, if you want, we have some time, I really, really recommend it to go to these publications. Something that we definitely know, that the human exposure to plastic and the chemicals from plastic is basically takes along the whole cycle. So it's not only the consumer use, but from the extraction, refining, and of course waste management. And yeah, I'm always using this slide because it's important that actually that's something that the regulation is not really addressing properly. But we always having the regulate chemicals on finding what is the safe threshold and concentration we could be exposed. But the fact is actually, this is very well dogma in toxicology, that it's not only important how much, but when. So you have this critical window of exposure in utero during infancy, and the fact that we already find that the different scientific publications are finding more like 200 synthetic chemicals that have been found in umbilical cord blood. That basically means that this fetus during the development is also exposed to those chemicals, and this is very, very bad news. And also when we have actually, we regulate chemical by chemical with the safety threshold, but definitely not all the levels means that are safe levels, especially endocrine disrupting chemicals are very tricky. We don't really have safe threshold for carcinogenic or reprotoxic chemicals. And the truth is that we are actually exposed repeatedly daily to the mixtures of chemicals, and this is something still very much understudied. And then, so I mentioned that we already were finding those chemicals in the umbilical cord blood, but we are actually finding them all over in the body. There was a big, 5 years, the biggest so far human biomonitoring study, and they found actually that we are all having a lot of different chemicals, and those especially known already that are harmful, like PFAS, so bisphenols used in plastics, phthalates, and all of them actually are found also in the levels that already are above safe levels. And basically, well, just I think last month I've heard someone from this project to saying like, scientists still have a lot of work to do to look for other chemicals, but the policymakers should panic because that's really, really very bad sign of what's happening and about our exposure. And just, yeah, as we are talking about the medical, there is, of course, a lot of also those plastic and different chemicals, the same chemicals mentioned, phthalates, different flame retardants, BPA, in different sectors. And so they basically, this exposure happens to the workers, but definitely also to the patients. And this is still not, I think, properly recognized the issue of premature babies that are well, they of course need the neonatal intensive care, but they are subject to very, very long, intense, repeated medical treatment. And we know from the I don't hear, but here you see it from the opinion of scientific committee that those levels are actually really high. So the risk that those children will have in the future some effects is quite high. And in Europe, basically, the exposure to the chemicals and health the exposure to chemicals is related to the, like those, you see the 10, the most, let's say, frequently diagnosed diseases, including cancer, heart diseases, diabetes, and asthma. And we actually know that the global rates, but also in Europe rates, they are growing. So if we do this kind of like a summary every 10 years, this is only getting worse. Actually, recently has been also published that like Europe is only have like 6% of the total population, global population, but we're dealing with more than 20% of the cancers. And this is, unfortunately, also part of it is related to the chemicals. And our exposure, and some of the chemicals, this we also don't have any doubts anymore that to some chemicals, if we are exposed, actually, that the next generation can have already some impact. So even if the children are not directly exposed through the first generation, they have bear with the consequences. And we have a lot of discussions about, yeah, that's of course, this is not only probably, of course, this is not only chemicals, but they play their role. And our society is living longer. We are getting, we are aging, so that's probably also the increase of the frequency of these diseases. But actually, the WHO and all the epidemiologists say that the speed with which the increased disease incidence can rule out the genetic factors, but it's really to high degree related to our exposure. And I'm going to read it, but in Europe there are different studies showing, the link between certain chemicals and certain outcome. PFAS has shown that it's really impairing causing immunosuppression in children. We know that actually those children who have higher levels of PFAS, they're actually responding worse to the vaccination. And like also ECHA, so the European Chemical Agency, made this estimation that just through removing a couple of like 4 phthalates you see below, that will save approximately 2,000 of boys from impaired fertility, and a lot of money we spend on the public health. And then is the microplastic, which I only have one slide. I already mentioned it's found all over in environment, and it's also found all over in our body, lungs, blood, human breast milk, placenta, recently also in brain, so it's there. We actually don't know really what are the effects. This is really like very emerging research. There's a lot of project going on, and expect that in a couple of next years we will see a lot of scientific publications. But this is something that is emerging and is very worrying. Let's be honest. So now let's talk a little bit about the circular economy, because as I showed in one of my earlier slides, the Europe we see that we have to change something in the pattern of our consumption. We have to move from this what you see here, the circular economy, when we waste enormous amount of resources, but we also produce huge amount of waste. So we should close the circle. And very often it's actually kind of understand that circular economy is equal to recycling, but it's not really the true, because it covers, when you really think about, you really have to start, first of all, with safe, sustainable design, because we know that actually at the design stage, you decide up to 80% of impact of any product on the environment. We actually really have to move from those single-use culture to start to produce items, products that are getting longer, that are more reused, they can be repaired. So basically, we have to make this phase before anything is wasted as long as possible. So we should reduce, reuse, and recycle. This is again something that Andrea showed, the waste hierarchy. And it sounds very logical, but actually what we see still, we are definitely doing too much on recycle than the other two priority. And of course, everything at some point is wasted, so that would be good to optimize recycling, and that will need also the developing clean production and processing, because yeah, we need to recycle stuff, but we need to be clean. And this is just to give you an idea, because we also very often we are thinking, okay, we make something recyclable or we are fine. We are helping the nature and we are basically supporting circular economy to a certain degree well. But the thing is actually that there is a really big problem with, for example, when it comes to plastic, with uptake of them. So we can recycle stuff, but there is still not really huge uptake of recycled plastic by the manufacturers. One of the reasons is actually the presence of hazardous substances, and that is also linked to the lack of trust in this, they call it secondary raw materials. And why we have so we have the problems still with the different hazardous chemicals. And as long as we are not really sure how safe the plastic is, it will be always difficult to use it safely. And this is, I just pick up three here, references that you can check it, but actually they all are about recycling or PET bottles. So this is the beverage bottle that we all basically having all over us. They use it, this is the most frequently used plastic bottle by the beverage sector. And those bottles have already the mandatory recycled content. And we actually kind of agree that this is still the best developed recycling technology, but still there are some problems. We know that we should recycle plastic as many cycles as possible to use it properly before it will be not really possible to recycle it anymore. But we see, for example, that with these recycling cycles, then the amount of hazardous chemicals is actually increasing. If you look at the recycled content, very often you find some chemicals that were never used in the original bottle, so there is still cross-contamination. And basically, also, if we look, this PET bottle still is filling the norms, but there is a lot of other plastic used on the market, and they are showing still too many toxic chemicals after the recycling to really use them properly, especially in the context-sensitive application, where we know that there will be also new mandatory recycled content soon. So this is just also a couple of examples. It's a lot of things are being published these days. So you have different, a lot is published about food packaging, because, as I said, this is actually really the focus of the policymakers as well as the manufacturer. But you could find also, for example, the toxic chemicals in recycled plastic that is used in toys and many different things. We know, for example, that is also in textiles. There are also quite some problems. So the question is actually that we still think that with all those concerns, I didn't really mention it, but we talk about also NIA, so that's non-intended added substances. So this is something that we really still are very poorly controlling. So we have some product, we try to recycle it, and in the end we find some chemicals that never should be there. And we are still actually, I think, still at the fact that we have to ask themselves that can we really create a truly circular economy that delivers safe, context-sensitive articles from plastic materials? I think it's a question mark, and nobody can, some people believe it. Yes, I'm already there, almost, solutions. So solutions are, I'm not going into the details, but I really recommend, I think this is really very good feature from one of those reports by UNEP. So well, first, the solution, we need to use less plastic. You should reduce overall use, but also regulate and phase out at the same time on non-essential applications, and definitely also clean the processing from as many harmful chemicals as possible. And the waste management is important, but this is more like on the fourth place because, yeah, to close the cycle. And I just wanted to say about something like alternatives, because what we do, and we see a lot, is that we, for example, one of the way of alternative is to use one chemical by another. But unfortunately, it's very often, it's so-called regrettable substitution, and this is just the bisphenol A example, which is one of the best studied, I think, chemical in the world. So it was actually started to be used massively since in 50s. It had been found that it's an excellent hardener for epoxy resins and plastic polycarbonate. Then you see in 90s already, there start to be reports showing that this chemicals is actually leaching from the product, and banned cause in 2010, 11, and 15 different bans in Europe, mostly on the children products. But then what we found actually, that yes, what did the industry, they come up with different bisphenols, which are basically almost identical, so have exactly the same effects. And yeah, so we have very often, I think you can see this BPA-free product. It's even kind of like promoted as more safe, while you have another bisphenol that basically causes the same. And also wanted to say something, regrettable substitution, you can also change your material completely. So you can, and that's what we see a lot now in the food packaging when the single-use plastic directive has been imposed, that, yeah, you go from plastic to single-use paper, and then you see actually there's a lot of problems there because actually it's very poorly regulated. Or you change to reusables, let's say packaging like those from this unfamous actually, this bamboo plates, cups that were marketed as children-friendly, but actually they are terrible, and we needed like a really wide EU action to remove it from the market because full of carcinogens and illegal chemicals. But it was actually really scary how fast those chemicals entered the market, and they became actually, you know, massive. So that's also for me is a sign that we are not really able to regulate it so well. And the recycling also, again, from other materials is also problematic. So the paper, very, very often you see of here, it's the one alternative green one, and it's not really performing as good in the circular economy, I think, and not safe as it should be. So key messages, I'm not going really to read them, but I think you understood what I wanted to say. We are exposed to harmful chemicals. The vulnerable groups are exposed. So we actually really should start to regulate chemicals better. We need to still find out how to make recycling really safe. And that's policymakers and businesses have really a role in scaling up of more safe solutions. So thank you very much. So the alternative materials, definitely the like glass, stainless steel, some ceramic can be, but of course it cannot be used, for example, for the flexible tubing, obviously, yeah. So there is something, but definitely, I mean, there's like this surgical instrument actually. Made from metal, they are actually inert, yeah? The problem is that now a lot of those stainless steel items are still used as single use. So this is actually really terrible. It's the huge waste. But then also, when you look actually alternatives, yes, I think what we see also, and especially in the developed countries, is that we use much more, in medical sector also, much more items than in the other countries. So it's like the most rich country, the more waste you, and Denmark is also one of the top. It's like, yeah, you have the money, you pay for that, so you have everything, and then you get a lot of, stuff, plastic and sheets, and like, are they necessary? It's kind of like, providing the best care, but sometimes I think that you can also reduce it quite seriously. And then with the plastic, actually, it's really a lot of also could be better, because I think that others will talk about it, like this PVC. Basically, it's a lot of already found. You can replace the worst plasticizers by other, less toxic, definitely, or you just completely move from one polymer to another one. It's of course very tricky. It's tricky. It takes time, yeah, because I think it's like now what we see in the food packaging. We just change one to another, and it's relatively easy, and nobody will make fuss about it. In case of medical devices, you need the whole procedure actually to accept them, and yeah, that's of course it's a different level of safety. Yes. Please. The regulatory. Well, I don't think we have like a really regulatory still requirements per se. We have more like a guidelines, and first things that we see now, and what the regulatory, the policy developments are going pushing the manufacturers is to design any product to be recyclable. Or reusable, of course, yeah, but that is really depending what is done. So that means, of course, that if you go, I don't know, from like let's say cup, yeah, from the single use, you can make it just thin. You can just test it for one use, and that's all. If you make something reusable, you need different tests. You need maybe different thicker materials, etc. And then you actually, by making something recyclable, so one thing is that design is important because you are avoiding multi-layers, putting something small piece of metal on your plastic that is just ruin your plastic recycling. But also, it's also the truth is that we still actually our capacity and the recycling technologies are not really really scale up. They are somewhere there. I mean, and it's also the recyclers were really not very much supported up to now. I saw this one slide. They doing the investing, then trying to recycle something, and nobody want to buy it. So yeah, that's not really something that incentive was high incentives. What we have now, actually, closer to the adoption, we have the. We'll have soon the new regulation on packaging and packaging waste, and there we will have indeed like a regulatory requirements to push for the certain hopefully so for example to eliminate certain materials, certain formats, stop to producing like something in very small pieces of something that's like the small sachets, micro bottles of shampoo and those stuff, because it's a lot of waste and it's never will be actually really recycled. So that's one thing, but still, honestly, that's like everything is going about technology and making something recycling, and also building the infrastructure to recycle. But the chemical safety issues are still not really addressed ambitious enough, honestly. We kind of like hear that the REACH has to improve, the whole revision is put on hold by the Commission. So we are pushing a lot into those sustainability, circularity, but actually the chemical safety is staying behind. The same is with the food packaging. We push for the recycling, but actually the food contact materials is put also revision on stop. Yeah? The Commission decided that they will actually focus on recycling, but we have a huge problem with non-harmonized rules. That's why we see so many problems with paper. There are not harmonized rules in the EU for paper. So actually you can use almost what you want there. And in some countries maybe there are some restrictions, some other, and that actually is for majority of the materials. So I think, we have still a lot to do. But I think the businesses can still use a lot of internal knowledge, because I think that actually businesses know very well what they are capable to do. But of course, I think that's why we need policy, we need the targets, because businesses need also to know the future to invest. They also have, the competition is not fair. Actually, those who are producing cheap and nasty and dirty stuff are still kind of winning because, yeah, they are winning. So yeah, it's a lot still to do, but I think, yeah, if collectively will push for it and ask for it, then there's still huge margin to improve in the future.
I saw there were a couple of other questions. Maybe both of you, like if you can both say it, then maybe you can answer them together. I hope they're kind of related.
Let's hope they're related. Regulation should support the good standards, yeah. No, absolutely. So yeah, that is like that. But this is still, standards are still not obligatory, and that makes a little bit of a problem because that needs again investments. You have to normally something fulfilled better standards are more expensive. It's more durable, but somehow, yeah, it's not really the biggest. It's not always the target for someone to buy something the more durable. It's still economic incentives, and there's still a lot of businesses and a lot of retailers, and the whole society in general is choosing the cheap one. And that's why we need policy, because we know that if you put some targets, actually you really force to some change. Yeah, that's a kind of like already proven. We have a lot of initiatives, a lot of voluntary pledges, and unfortunately they bring really very little.
And maybe if I can add something on standards, I mean, I think regulation is still really what we should be pushing for and what we need. When it comes to regulation, there is a lot of lobbying from the industry to weaken it, and they say, oh, we'll just create our own standards or our own certificates, but then they kind of play by their own rules, and maybe their standards or certificates are way weaker than what the initial regulation could be. So we have to be careful, especially with how independent the standards are, who creates them, because sometimes they might actually be promoting something that is not necessarily good for the environment.
But I'm guessing that in this case, actually, the public authorities are promoting the world standard, and this is important. Who is actually using those standards? And so, not to really just to sell, but to buy. No, I'm afraid not, because there is no transparency. Yeah? Unfortunately, we don't know what this, and actually, the manufacturers are regularly, not providing even the law requirements. They not inform. There is a long-term already requirement to inform about like substances of very high concern. They should be actually really indicated on any product. They are not. No, and that's why also now, so in all those discussions about what is so that this packaging with regulation, but also another, the eco-design for sustainable design regulation, is the idea is also to bring this, they call it like a digital passport. So basically, yeah, because that's what we know. It's important for the manufacturer, but also for the users, but also extremely important for the waste management, yeah, because that's also one of the problem is that the recyclers or whatever what's happening with the things, they don't know what they're getting, and it's huge amount of the problematic chemicals they are not intentionally introducing because they just mixing the dirty one with the clean one. And so yeah, but how? Yeah, we hope so. Yeah? That there was now the development about this digital passport and requirements for the information. But of course, that will still need some adjustment of the infrastructure. And I'm afraid that the manufacturers, or maybe let's say chemical industry, is not very happy about it at the moment. So they will definitely put, but that's why maybe again we as end users we really should ask for it. We have to push it for it, because industry will never do it. I had like this kind of crazy conversations in the meeting, like somebody from the company was saying, but we cannot say that we use this harmful chemical because it will make our clients scary. I'm using it, but I don't want to tell it about it because You know, that doesn't sound good. So it's really, it's actually ridiculous, but we need more transparency. So I really, I think that's has to come from us, from the users. If we push for it, I think this will be much more easy for the authorities to also to implement it.